Welcome! Today, we're going to quickly talk about the top 5 challenges that PCPs face in modern healthcare. Hello, my name is Mike. I'll be your guide for this video. Let's go ahead and jump right in. Healthcare in 2023 is a different landscape than it was 10 years ago, or even 5 years ago. There have been a lot of changes with the way physicians provide healthcare to their patients. The medical record going digital, large-scale adoption of telemedicine, and a global pandemic, for example, have changed the industry dramatically. Over 50% of physicians report not having high professional morale right now, and further, they wouldn't even recommend that their children go into medicine as a profession. In 2021, 1 in 5 physicians said that they plan to leave the profession in the next 2 years. So, to shed some light on this trend, let's count down the top 5 challenges that PCPs are facing in modern healthcare. Number 5. COVID-19. Let's get the elephant in the room out of the way up front. The global COVID-19 pandemic has been the single biggest challenge, as well as the catalyst for several changes that have come about in the last 3 years. One of the biggest was the switch to telemedicine for basic screening and triage purposes. It's not appropriate for all scenarios, but it is great for minor physical examinations for things like rashes or symptom management, and providing mental health care as well. The downside is that computers and networks suddenly needed to be upgraded or replaced, as well as updating physicians who are not tech savvy on how to use the new technology. That all took time and money. Not to mention the enormous paradigm shift in how telemed was perceived, as it became mandatory for physicians all over the world and a permanent part of medicine almost overnight. Number 4. Lack of patient resources. Providers want to help their patients as much as they can, but that becomes hard when they are unable to help because of the socioeconomic circumstances felt by a rising part of the population. Patients who don't have basic access to food, housing, or medicine often have similar, less positive outcomes. These negative outcomes greatly reduce physician morale. Additionally, patients often can't afford primary care services, so they don't see providers until their chronic conditions worsen or become critical, at which time they seek emergency medicine rather than preventative, which is often more expensive and less specialized care. Number 3. Administrative and documentation burdens. Poorly designed EMR systems and providers being forced to see one more patient causes backlogs of patient documentation, such as charting and documenting, placing orders, coding, and billing. This causes delays in care and contributes to their loss in morale, feeling like they can never catch up. This burden robs providers of time spent with patients, which is what they would prefer to be doing. That's what brings them joy, not sitting on a computer all evening. For every 1 hour a provider spends with their patient, they're spending 2 hours on their computers documenting. That's double the amount of time that they get to spend with their patients. Number 2. Workforce shortages. A September 2021 report from the Kaiser Family Foundation noted that 83.7 million people in the U.S. live in a designated primary care health professional shortage area, or HPSA, and more than 14,800 practitioners are needed to remove the HPSA designation. It's only gotten worse over the COVID-19 pandemic. Education is also a factor. There aren't enough physicians in school nor seats available in medicine programs to be able to make a dent. Plus, educating and training new physicians is expensive and time-consuming. Data published in 2020 by the Association of American Medical Colleges estimates that the U.S. could see a shortage of 54,100 to 139,000 physicians by 2033. That number is staggering. It's clear to see that given all of these factors, the number one biggest challenge that providers are experiencing today is physician burnout. Physician burnout is a real challenge, as these physicians are faced with a severely imbalanced ratio of too many patients and too few providers. Not to mention that there are many other challenges and concerns that they're faced with other than the ones we've talked about. For example, computer EMR literacy is a real challenge when providers are already not tech savvy and then are forced to use systems that don't communicate with each other, are often slow, extremely click heavy, and are geared toward billing and coding, not provider documentation. Providers also have a real fear of legal action being taken against them due to the potential for mistakes to be made during hours and hours of computer charting and an overabundance of patients. Overloads of work cause errors in charting and ordering if they aren't constantly vigilant and accurate in what they document. Providers also experience personal burnout. Their profession often affects their home and personal lives, which causes additional stress and distraction. Providers are feeling increasingly undervalued as well, both figuratively and literally, or more specifically, financially. The current fee-for-service model undervalues primary care, resulting in delivering only 5% to 6% of the total medical spend to those primary care services. This issue can be solved by investing more in primary care. Countries that spend more on primary care have better health outcomes and lower overall costs. The last major physician concern we'll discuss is mental health care for patients. The last few years going through the pandemic, there's been a severe increase in the mental health needs of patients. But just as there's a shortage of clinical physicians, there's also a shortage of licensed social workers, so providers find it difficult to be able to spend time to find good community resources to aid the mental stresses of their patient populations. So what are our takeaways and what can we do to work with providers in this current climate? Well, we've spoken a lot about cumbersome, ineffectual EMR systems stressing out providers, so if we can speak to how our solutions will make their lives easier, not harder, that's a plus. Stress that they can save time by leveraging machine learning and AI offered in our solutions, offer them increased level of community resources for their patients, and improved coordinated care in record time. Stress the telemedicine network that is easy to use and will help them alleviate feelings of burnout and fatigue. Keep in mind, they may not be the most receptive to yet another computer software, as providers are less than excited to have to learn and use yet another software. So it's up to you to get them to see how our solutions are different and unique, and could be the last system they'll ever have to learn. Interacting with providers in these times is a challenge in and of itself. When trying to get FaceTime with a physician, and while you're with them, I like to remember the 3 Ps. Be personable, be patient, and be persistent. It's important to be personable with providers. We always want to keep the energy positive in nature, or sincere when needed. Humor is a plus if you can make them laugh, and understand that they're likely having a rough day and could use a bit of empathy. It goes a long way. We always want to be patient when trying to get in front of a provider to speak with them. They have very busy caseloads and are often rushing from one appointment to the next. Many times, there are cancellations and reschedules, as well as walk-ins in some offices, so provider schedules are always changing. Be flexible with them when scheduling appointments and allow yourself time to wait for them to get a second for you. Don't hold it against them, keep things positive and quick. Lastly, we want to be persistent. Sometimes providers will have to cancel appointments with us due to their changing schedules. Find time to reschedule with them or their scheduler. Sometimes you may have to work with their scheduler or receptionist or assistant directly to be able to get on their calendar. Be resourceful. Sometimes that might mean getting there really early, sometimes it means giving up your lunch, and sometimes it means meeting them at the end of their day when they're the most stressed. Persistence will prevail when trying to get in front of them. We hope you found this video informational. We've covered a lot today. We talked about the top 5 challenges that physicians are facing today, such as COVID-19, lack of patient resources, administrative and documentation burdens, workforce shortages, and most of all, physician burnout. We even reviewed 5 additional concerns like computer EMR literacy, fear of legal action, personal burnout, feeling undervalued, and mental health care resources for patients, as all real concerns for an ever-shrinking provider population. To work with them, we can stress the benefits of our solutions and how they alleviate stress, burnout, and return time back to their days, as well as all the benefits for their patient population and how they'll be helped. Lastly, remember the 3 Ps. Be personable, be patient, and be persistent. Thanks so much for watching. We'll see you next time.